Sofinnova Partners has closed a new fund dedicated to supporting biotechs moving through its BioVelocita Accelerator, a strategy. The firm has expanded beyond Italy to stretch across Europe. You are listening to the BioCentury This Week podcast. I'm Jeff Cranmer. We'll also be discussing Novo's latest obesity deal, U.S. Biotechs competition with their China rivals, and President Trump's threat of pharma tariffs. Joining me today to discuss all of this are my colleagues
Paul Bonanos, Director of Biopharma Intelligence.
Simon Fishburne, Editor-in-Chief.
And Steve Usden, Washington Editor.
All right, before we dig into all the things we have to discuss, I'd like to tell you about a webinar that we will be putting on with investment bank Oppenheimer. It's Tuesday, and of course, as Steve said in the run-up to this, that's all relative to where you are in the world, which is a great line to use if you miss your spouse's birthday. You can just say, I was on Japan time. What is this webinar? The economy, policy, and the path forward for biotech. We have a great lineup of speakers. We'll have Michael Margolis from Oppenheimer. We'll have Chris Barden from MPM, Christoph Broha of EQT, and Brett Zabar of General Atlantic. It will be moderated by BioCentury's Stephen Hansen, and it's free to register. You can listen live at 11 a.m. New York City time and ask questions, or you can register to receive access to the recording. BioCenturyWebinars.com. All right, we have another event that we want to tell you about. It's our Grand Rounds meetings. We'll have two of them this year, one in Chicago, one in the UK. We'll talk about that a little bit later. But now I want to get into Paul's story on blue chip European VC Sofinnova Partners. It has raised 165 million euros to support its pan-European accelerator. Now, Paul, I believe you spoke with Graziano over at the firm. What did you learn?
I did, yes. And just to clarify very quickly, there are two Sofinnovas. We say this every time. This is the Sofinnova in Europe, Sofinnova Partners. It's separate from Sofinnova Investments in California. And yes, this is part of a broader fundraise by them. We learned a few weeks ago that Sofinnova Partners has about 1.2 billion euro in fresh funding, and that's spread out across multiple funds or multiple strategies, as they call them. Typically, they are discrete funds that are associated with these strategies. Sofinnova has a core strategy investing in life sciences, but also several specialized strategies in addition to that. A total of 7, for example, medtech, a crossover strategy, a gene therapy strategy based in Milan, and so forth. And in this case, this is for BioVelocita, as Graziano pronounced it. That's an incubator that initially operated in Italy, and now they're expanding the strategy across Europe to help startups, typically academic spinouts, get off the ground. And it's got 165 million new euro in capital to do it. Like most incubators or accelerators, the idea is that the firm takes a management role during the early days of a company's life cycle before bringing in new leadership later on. And in the meantime, it supplies lab space, some other infrastructure, capital, and access to its network as well. So a bunch of resources for a good idea coming out of academia where maybe the scientific co-founders aren't going to be C-suite leaders or will be taking scientific roles, but not other management roles at the company, like CEOs. So the partners step in or other staff at the firm to operate. And I talked with Graziano Segezzi at Sofinnova. He says this is now the largest incubator in Europe. The Italy version was kind of a pilot version. It started in 2015. It had something like 15 million euro to work with, and they see it as a success. There were a few projects that went through it. There's one called Enthera that came out of it that has since attracted a Series A, a new CEO who came in from AbbVie, and they're looking to expand on this and apply the model elsewhere with 10 times as much capital, more than 10 times at 165 million euro. There are at least 3 startups they've disclosed so far that are going through it. One is a fibrosis company in Scotland called Forth Therapeutics. That's like the Firth of Forth, Forth. A cell therapy company in Paris called Signadori, and another one in Italy that's looking at neurodegeneration. That's called Biotechs.
So I'm going to use this for a shameless plug. I'm also going to make sure that Paul covers all of our European companies, since he's really got that accent thing down to a T, it seems. Very nice pronunciations
Much
there.
better, much better than yours truly here.
I didn't like to say. Anyway, so in terms of shameless plugs for Grand Round, so first of all, I do want to say it is great that they're doing this. One of the things that comes up over and over again is the amount of really high quality science there is in all of these places around the world, including Europe, that it doesn't happen to be San Francisco, Bay Area, or Boston, Massachusetts. And so, their effort to commercialize this or translate it into and put it into programs is very good for the ecosystem. And this is actually what we aim to do at Grand Rounds. We have one in Chicago, June the 4th to 6th, one in Cambridge, UK, September 17th to 19th. And what we're trying to do there is bring together academic entrepreneurs and innovators with VCs and farmers. And the content will discuss really critical bottlenecks in translation. But Jeff is presenting companies and posters and all kinds of ways that we agree with Antoine and Sofinnova. There's really a need to try and bring together these different stakeholders to actually, do what happens organically in San Francisco and in Boston and doesn't seem to happen quite so smoothly in the other hubs.
That's right, Simona. Right now, I am busy recruiting early stage biotechs, doing super cool stuff for our Grand Rounds conferences. So if you would like to join us, drop me a line.
Not semi-cool, just super cool, right?
Super cool.
Yeah, I'm glad you mentioned the kind of growing ecosystems in Europe. I mean, every country is different there. And my ongoing conversations with Sofinnova over the years, Graziano in particular has mentioned, Italy is sort of an up and coming place. It's hard to build an ecosystem when you haven't had serial success, serial entrepreneurship, management teams that have been through an exit and kind of either get the band back together or try and repeat their success in some way. Spain, we've seen that one growing a bit too. There are more developed ecosystems toward Northern Europe, France, the UK, the Nordics. He said Germany is actually really ripe for innovation, and he's looking for the ecosystem there to grow as well. So they're hunting for deals up that way as well as in Southern Europe. And, it'd be exciting to see what comes out of all that.
So you heard it here first. German innovators come to Grand Rounds. Maybe you will meet people from Sofinnova there.
Excellent. Well, Paul is a sometimes guest on the podcast. If you don't know him already, he is a heartbroken fan of the team formerly known as the Oakland A's. He also happens to be our news editor, gets up very early in the morning and checks out what's going on, the wires. He's looking at FactSet. He's getting emails about the latest venture rounds and the like. And one of the things that Paul was watching this morning was a deal by Novo Nordisk, which is paying $200 million up front for X-Greater China rights to a new obesity therapy. Paul, what did you learn?
Well, this one crossed the wire before I get up. Not too many of us on the East Coast were up at the hour this was announced, but I saw it pretty early. So yes, Novo is doing a deal in China with a company called the United Laboratories. It's a subsidiary called United Biotechnology, and they're gaining access to a triple agonist for obesity. The targets are GLP-1, GIP, and glucagon. As you said, the price is $200 million up front. The biobucks go up to $1.8 billion, and it's for global rights outside of Greater China, which means in this case mainland, Hong Kong, Taiwan, and Macau, to the program. It's one more obesity candidate for Novo's toolbox. Obviously, they're doing great with semaglutide so far. CagriSema has kind of been the next one up for a while. That's it combines semaglutide, the GLP-1, with an amylin receptor agonist, cagrilintide. The results have been coming in. They've There have been times where they've been a little underwhelming so far, but the jury may still be out on where it winds up. And now this is another combo approach, not with aniline this time, but the trifunctional approach I mentioned, GLP-1, GIP, and glucagon. It has generated some clinical data thus far, about 15% weight loss at 12 weeks in a phase 1b study. And with a large pharma coming in, it figures to accelerate development worldwide. It's another example. We've seen so many of Western companies, Western biopharmas reaching into China to find an asset, maybe at a lower price than you might find in the West, maybe generating clinical data faster than it would have in the West as well.
Yeah, the chatter at our East-West meeting in Singapore a couple of weeks back, I think some of the Western executives are feeling like it's not so cheap anymore, these assets. But of course, the folks from China are like, yeah, we wouldn't mind seeing the prices go up a little bit. Now, Simone,
you may have seen a data bite about that, where we've mapped out about 100 deals since 2019 when the curve is picking up. And the frequency of deals obviously is picking up too. The past few months have been unprecedented.
Yeah. So, I mean, this is just this huge topic right now among biotechs. I was at an event last week with a whole bunch of biotechs and investors in the room. And really a hot topic was this innovation coming from China. And in particular, Western biotech seeing this, as a threat, as competition. And you're right, Paul. One of the key things is that they can generate data so much faster in China. And I'm going to be writing a little bit about this soon because I think it's very important. But I want to say, there is at the moment a cost arbitrage. I think you're right that it's going away. And I think most people expect that to narrow over time. But to think that it's only because it's cheaper is kidding yourself. I think there's a lot of high quality things coming out of China. And there's a certain amount of burying your head in the sand, people thinking that the China data don't compare with what they can produce in the West. Well, they do it a whole lot faster, and the VCs and the farmers are quite happy to take that data. They may have to reproduce it, but they would do that anyway with that level of data here. So I think that the way that people need to think about this is, we talked before about hubs, right? San Francisco, Boston, doesn't really matter where the hub is. It's just another whole bunch of people generating high quality data that is now a source of competition for you. And I think that people in the West will need to respond to that. Biotechs everywhere.
Some hubs have better Xiaolongbao than others, Simone. You gotta know where to go to get your latest biotech innovation and soup dumplings. Simone, I promised our listeners last week while you were off traipsing about that fancy meeting that we'd talk a little bit about Jack Draper, who, rising star. Well, it looked that way at Indian Wells, but then he went to Miami, and I don't know if it was something he ate. But what's your take? Is he the next great tennis hope for the UK?
I think you jinxed him. I think it was you, Jeff, because it was going fine. And he won in Indian Wells.
He did.
And did a fantastic show. And then you talked about it. And suddenly he's out. So I think that, all of these people who complain about correlation and causation, I mean, this seems pretty clear to me. You jinxed him, Jeff. So you're next from talking about Jack Draper anymore.
Okay, I will keep my mouth shut, but it's not for lack of love of England. I've got a bit of that blood coursing through my veins. My dad swears that we're related to the Archbishop Cranmer, but I seriously doubt that. Let's take a quick break. We've got Mr. Steve Usden waiting in the wings to bring us up to speed on what is happening at FDA, what is happening with these potential tariffs on the biopharma industry. So we'll get to that after this.
BioCentury This Week is supported by the BioCentury Conference Series. For 3 decades, BioCentury has helped biopharma executives and investors make business-critical decisions and build larger networks with peers across the biopharma innovation ecosystem. Our goals are simple. Gather the right people in the room to partner, network, and debate critical issues facing the biotech industry. BioCentury's upcoming events span the globe and feature topics from translation to company building to deal making and investment. We hope to see you on the road at an upcoming BioCentury event. Visit biocenturyontheroad.com for more information and to register.
And we're back. I'd like to turn to Steve now. Steve, on Friday, you wrote about the potential tariffs that may hit the industry. What did you learn?
I learned a lot about tariffs last week. So there's two kinds of tariffs that we're potentially talking about. President Trump said last month that he intends to impose 25% tariffs on imports of pharmaceuticals across the board. So that's a sector-specific tariff. And of course, there are tariffs that have been imposed, there are tariffs that have been increased, and there are tariffs that have been promised on countries across the world. Some of them are reciprocal tariffs, some of them are tariffs for other reasons, Canada and Mexico, and there have been tariffs that have been discussed about Europe also. So, about the 25% tariff on pharmaceuticals, what would that mean? It would, first off, it would increase the prices of drugs, which you would think is in conflict with some of the Trump administration's goals, which are, of course, to lower the prices of drugs. According to the Yale Budget Lab, which is a nonpartisan think tank, a 25% tariff on pharmaceuticals would increase the prices of drugs 8.5% to 10.5%. Pharma tariffs would also impose large costs on consumers and on pharmaceutical companies. The total, according to PwC, would be about $76 billion in the first year. Not all of that would be passed on as higher prices. Drug companies would have to swallow some of it. In some cases, it will make it unprofitable to market specific drugs in the United States. That's especially true for generics, which operate on very, very thin margins. So companies would likely stop marketing those drugs in the United States. This would cause shortages. One of the things that I learned working on the story that was interesting is that Ireland is a powerhouse when it comes to pharma exports to the United States. 26% by value in 2024 of pharmaceutical exports to the United States, or imports in the United States. What's interesting is that this number is a little bit deceptive. A substantial portion of it is because of accounting. So Ireland has created tax incentives that make it an attractive place to do manufacturing. So there is a fair amount of pharmaceutical manufacturing there. The other thing that it's done is it's created a very favorable tax rate on profits from IP. So pharma companies assign a large portion of their IP to an Irish subsidiary. And then when they import the products to the United States, the import price is the cost of the goods plus a portion of that IP, which is then taxed at the lower Irish rate instead of the higher American rate. This wasn't a problem when there were no tariffs. And by the way, pharmaceutical companies have assumed for decades that there wouldn't be tariffs on pharmaceuticals, in part because in 1994, there was a WTO agreement that abolished tariffs on pharmaceuticals. There are 34 countries that have signed on to it, including the United States and all of the U.S. trading partners in Europe.
Steve, yeah, it sounds like you really had to do your homework to get into the nitty-gritty here. I'm impressed that you were able to stay away. It sounds like going back to school. What are the pharma companies doing to counter this threat, or to, I don't know, what's happening with companies like J&J and Lilly? And
that's right. J&J and Lilly both are in the vanguard of attempts to try to head off tariffs, in part by proactively announcing large investments in manufacturing expansion in the United States. They hope that in doing that, they will persuade President Trump that it's not necessary to impose tariffs in order to achieve his goal, which is to have more pharmaceutical manufacturing happening in the United States. It's yet to be seen whether that will be successful. Even if the sector-specific, the pharmaceutical-specific tariffs are not imposed, country-specific tariffs could still squeeze biopharmas in a few ways. One is costs of raw materials, chemicals, API, et cetera, that's used to manufacture products. Another is generic drugs and APIs, especially from India and China, that would be caught up in reciprocal tariffs or increases in tariffs on those countries.
All right, Steve, let's head over to FDA now. You had a piece last week taking a look at what life is like for FDA employees going to the office. It was mandatory for employees in the greater Washington area to go back to work. How did that look?
So last Monday was the first back to office day. It really isn't back to office because a large number of these employees had been hired, have had contracts that allow them to be fully remote or to have extensive telework arrangements. So I did what a lot of people at FDA did. I got up 6 o'clock in the morning on Monday morning. And I drove out to White Oak in Silver Spring, where the FDA campus is, and I saw the lines. There were long, long lines of cars to get into the campus. There were lines of 45 minutes or an hour or so to get through security to get in. The other thing that happened is that a lot of people couldn't find parking. FDA rented parking spaces in downtown Silver Spring and ran shuttle buses back and forth. I didn't get in, I didn't go in, but I talked to people who went in, and they told me that when people did manage to get in, a lot of them found a kind of chaotic situation. They were assigned to conference rooms with 20 other employees from different parts of the agency. They had to scramble to find desks and phones and things like that. I'm told that on the second day, on Tuesday, that things had settled down somewhat, the situation with parking, the lines and so on aren't as long as they had been. Then there's another issue that people at FDA are facing. Thousands of employees at FDA and IH and CDC who were fired by the Trump administration in the first round of DOGE cuts are kind of in a purgatory. So a federal court has said that the mass firings of people who were on probationary status was illegal. The agencies have brought those staffers back onto the payrolls, but they're not bringing them back onto the job. They're still on leave, so they're at home on paid leave, and it isn't clear at all what's going to happen to them going forward for two reasons. One is the administration is appealing the court order to rehire them, and the second is that the Trump administration is preparing large-scale layoffs, what in government's called reductions in force, and those will come into effect sometime in the next few months. And so many of the employees who have been brought back on temporarily are likely to be riffed in the near future. One thing that I'm hearing as a result of all of this is that a lot of people are leaving FDA voluntarily. I think we're going to hear some high-profile departures in the next week or two that I've been told about. So basically what I wrote on Friday is that incoming FDA Commissioner Marty McCary, who, by the way, I think is going to be confirmed tomorrow, as soon as tomorrow anyway, he's going to face a very difficult situation when he gets to White Oak. And I think that his first job is going to have to be to try to stabilize morale, to try to persuade people who haven't left to stay, and to find some way to deal with the kind of chaos that's been created by the back to work order.
Thanks for that, Steve. I will drop links in the show notes to both of your stories. Subscribers can also find them on our Hot Topics page focused on navigating Trump 2.0. Also on BioCentury, you can check out our sister podcast, the latest episode. Simone sat down with the CSO of Vertex, a big Doug Flutie fan, as it turns out. It was also just a great conversation about Vertex's approach to research over the past decade and more. Another one of our BioCentury shows that we get a lot of great feedback on that you should check out. It was our first one of the year. Steve sat down with Rep. Jake Auchincloss. He is a member of Energy and Commerce, has a very deep understanding of the biomedical innovation ecosystem. It was just a pleasure to have him on and hear him get into the nitty-gritty behind the scenes of politics in Washington with Steve. So check that out wherever you get your podcasts, or you can also see it on our YouTube channel. Thanks for tuning in. Thank you, Paul, Steve, and Simone, for joining me. And as always, thanks to Cole Travis for making this show run smoothly. Kendall Square Orchestra provides the music for BioCentury this week. The group connects science and technology professionals and other members of the greater Boston community, collaborate, innovate, and inspire through music while supporting causes related to healthcare and education.